Mixed porphyria and acquired porphyria. First, we'll discuss the mixed porphyria. This type of porphyria can lead to a symptoms of both acute porphyria and cutaneous porphyria. Right? That is, the skin and the neurological problems are there. They can therefore cause abdominal pain, affect the skin, nervous system, and may cause psychiatric problems. The mixed porphyria include variegate porphyria, hereditary coproporphyria. Don't get confused. These two porphyria are discussed before in the acute type and the chronic type. Same enzyme deficiencies. I have only revised here to show that they are also classified, they are also called mixed porphyria. Right? I have described in detail there because they are acute and chronic. Some of them are acute and some of them are chronic, but they are also called mixed porphyria. It is the same porphyria which we have discussed, right? But the symptoms are mixed. Cutaneous symptoms, neuro symptoms, right? Therefore, it is known as a mixed porphyria. So, variegate porphyria, due to the deficiency of protoporphyrin oxidase, we have discussed in the last lectures. Hereditary coproporphyria, due to a deficiency of coproporphyrin oxidase. We have also discussed this before. Here you can see the deficiency of the enzyme which I have mentioned in the last slide. Variegate porphyria, as it is called mixed porphyria, I have told you it is a mixed porphyria. You have studied it before. Again, I am saying to you in the last lecture, in the lecture 9, in the lecture 10, we have covered this porphyria. It is the same porphyria. I am only revising here to show you that it contains the mixed symptoms, mixed neurological and skin symptoms. Chronic skin abnormality result from the photosensitivity, a condition in which skin is abnormally sensitive to sunlight, causing blistering skin lesions. Some individuals with variegate porphyria only develop skin abnormality, while the other develop neurological symptoms, and some have both. Now it should become clear that why we have discussed it before and why we are discussing it afterwards also, because some individuals, they develop the both type of symptoms, neurological symptoms together with the skin abnormalities, and therefore we have included this in the mixed porphyria. We have taught you as an individual porphyria also, acute or chronic, and then I have here discussed it as a mixed porphyria because since some of the people, they develop mixed symptoms. Symptoms include fragile skin, फट जाती है, blisters appear होते हैं, milia appear होते हैं. What are milia? They are tiny wide bumps, white growth you can say, or cyst. Excessive hair growth is observed. Blisters, they heal slowly and form a scar, leaving patches on the skin. समझ आए? शायद आपने देखा हो, मैंने देखा है ऐसे लोगों को कि they have a patches on the skin of brown, और वो जो बिल्कुल scales की तरह झड़ते हैं जब लोग सोते हैं, कुछ होता है. They can be of abnormally dark hyperpigmentation or skin or light hypopigmentation. Sometimes the patches on the skin, they are of dark pigmentation, and sometimes it is of light pigmentation. Then the other type of the mixed porphyria is the hereditary porphyria. ये भी हमने देखा है, ये भी पढ़ा है अभी पीछे. Hereditary coproporphyria is an inherited disorder characterized by acute neurovascular as well as chronic blistering cutaneous manifestations. You can see here both type of symptoms will develop in the patient, neurovascular as well as cutaneous. Abdominal pain होगा, nausea होगा, vomiting, diarrhea, tachycardia and hypertension. Neurovascular or cerebrovascular disease refers to all disorders in which an area of the brain is temporarily or permanently affected. अगर brain affect हो रहा है, temporary हो रहा है basis पे या permanently हो रहा है, obviously the cerebrovascular disorders will be observed. कुटेनियस फाइंडिंग्स क्या होती हैं? स्किन फ्लैजिलिटी हो जाती है, बुलस लेशंस आफ्टर एक्सपोर्ट। बुलस लेशंस का क्या मतलब है? छाले पड़ जाते हैं एंड देन द स्कैरिंग इज इंक्रीज्ड because it can have both neurovascular and cutaneous manifestations, therefore it is called mixed porphyria. Then we come to the acquired porphyria. ठीक है, जिस तरह से acquired कोई भी disease होती है, whenever you come across, you always think that certain factors or certain other diseases, they are responsible for this type of porphyria. They are triggered. You can say they are triggered with some factors or other diseases. Certain factors trigger impact on specific enzyme production. ठीक है, for example, this acquired porphyria is triggered by the large amount of iron in the body, liver diseases, estrogen medication, especially for controlled birth program, smoking, excessive alcohol. All these symptoms all these factors they can lead to acquired porphyria. Hereditary porphyria. Number one type is hereditary porphyria. Is an acute hepatic porphyria. अभी हमने पीछे देखा है, ठीक है? And we have put it in this porphyria because it is triggered by some chemicals. तो जो चीज़ भी we have done in the mixed porphyria also, we have revised this, we have placed this, because porphyria, it can classify it into many ways. Some people, they classified porphyria only into acute and the chronic type. Some classify porphyria as acute, chronic and mixed type, and I have classified porphyria into acute, chronic, mixed and acquired. ठीक है? So you can see here that disease is triggered. When I say that the disease is triggered by certain factors, it means that I have to place it in the acquired porphyria. It is actually a hereditary porphyria which you have studied before, right? And the same enzyme which you have studied before, called coproporphyrinogen 3 oxidase, is deficient. Coproporphyrin 3 is excreted in large amount, and the disease is triggered due to, you can see, the exposure of toxic chemicals, heavy metals, sample lead. Certain diseases, they can also trigger this type of porphyria, such as liver cirrhosis due to alcoholism, poliomyelitis and Hodgkin's disease. Then the coproporphyria type 1. It is due to the deficiency of uroporphyrinogen 3 synthase. Porphoblinogen is not converted into uroporphyrin 3 and the amount of all porphyrin 1 is increased. I'll just show you. Large amount of porphyrin 1 is found in urine, and this porphyria is triggered by obstructive jaundice, liver cirrhosis, hemolytic anemia, pernicious anemia, leukorrhea. These are the triggered factors which which are the causative agents of coproporphyria type 1. Here you can see porphoblinogen. It is not converted to uroporphyrinogen 3. होता क्या है ऑटोमेटिकली इट इज कन्वर्टेड टू यूरोपोरफायरिनोजन एंड कॉप्रोपोरफायरिनोजन सो द porphyrin type 1 are increased, and when the porphyrin type 1 are increased, then this lead to the porphyria, which is the coproporphyria type